We now know the Wisconsin Department of Health Services has distributed about a third of the money it's set to receive from that massive settlement with opioid manufacturing companies. Now, here's how it breaks down. As of December 30th, DHS says it's put $6 million toward grant funding for tribal nations, another $2.5 million to cover room and board statewide for people in treatment programs. They're also funding prevention education, fentanyl testing strips, and an expanding program for the anti-overdose drug Narcan, which Gunderson emergency medical doctor Chris Eberlein says is greatly needed.
This has saved hundreds of lives in our local communities, without question. And in fact, it's probably higher than that. You know, we are getting saves just about at least several times a week.
And while Dr. Eberlein says the money is helpful in what's been an ongoing battle for more than a decade, real progress, he notes, won't come from this settlement.
We've got to really start focusing on the social determinants of health that led to addiction in the first place. And that's really where you're going to start seeing benefits, but you're not going to see them for a while, because this is, making sure people have the proper mental health, proper housing, and all these other determinants that go into driving addiction and crisis in their life.
Now, the DHS Secretary-designee Karen Timberlake says they are operating on a limited time frame to get that full $30 million allocated, having received $24.6 million late last year. She adds in a statement, however, the state health agency is working fast to ensure, quote, community partners have adequate time to respond to funding opportunities.